Hi, my name is Anna, and today I'll be performing trach care. I have sanitized this table. I have checked the patient's vitals, hydration, and nutritional status. I have hooked up the patient to the pulse oximeter, making sure we're monitoring that. I asked the patient his pain level. He states it's a 0 at this point. I sanitize my hands. And I'm checking his overall appearance, his skin turgor, checking his oral mucosa, making sure that he's hydrated, his nose to make sure that there's no polyps or anything. I'll go ahead and lower the bed rail and pull the patient up to a comfortable working position. Okay, this works. I'm on the patient in semi-fowlers, and I'll go ahead and sanitize my hands. And I'm gonna listen to his lung sounds. I start at the apexes of the lungs and move my way down to the bases, making sure that I note any atelectasis or any fluid in his lungs. That way I can determine if he needs to be suctioned. Up, and now I'm going to do his back. And again, starting at the apexes and going down all the way to the bases, asking him to take deep breaths. I sanitize my hands again. Provide the patient with a little towel. And I have determined that he needs suctioning. So I want to his pulse oximeter. Oh, I checked his ID and made sure that he that it matched the order to his name and date of birth. So now we're gonna place the suction to -80 to -120. So Jack's gonna go ahead and do that. And bring in sterile saline solution. And I'm checking that the date it was open was within 24 hours of today, and the expiration date as well. So I loosen it, sanitize my hands again. And now I pull this out. I avoid touching the inside of this tray. Like this, and flip it. And then I pour some saline solution in here. Cover it again. And connect this to suctioning device. And move this out of the way. And I moisten the tip while Jackie hyperoxygenates the patient. I introduce this until I meet resistance, and then intermittently I pull this while I circle around while Jackie hyperoxygenates. And then I go again, avoiding touching the outer cannula until I meet resistance, and then intermittently I circle around. Okay, at this point we're going to take a little break and listen to his lungs, make sure that what we've done is work. And so we ask him to breathe deeply reassess his lungs, make sure that they have cleared. All the lobes, it sounds like he's clear. So now we're going to perform some trach care. Sanitize my hands again. There's the trach packet. Checking the authenticity of each one of these and checking the expiration date on the peroxide. And I loosen the caps. I open my tray packet. So now I'm going to put in my gloves. Go ahead and put this to the side where he can still get some oxygen, but I can reach it. I'm opening it up. And I glove one side. With this hand, I'll go ahead and open these. Put them back, and with this hand, and empty this tray at the very edge. And this happened. This. Clean it up. And this one, if the cannula was metal, I would not put it in peroxide because it will oxidize. And then here, what I'll do is grab some gauze and Q-tip, and now I'm going to glove my second hand. Okay, so now what I'm going to do is I'm going to remove the cannula, place it in the peroxide, place it here, one of these, and okay, put some oxygen in there. Okay, so now I'm going to take care of the stoma. So I'm going to remove the old dressing and make sure I check for coca, color, odor, consistency, and amount. I'm going to throw it away. And I'm going to grab this Q-tip over here and start cleaning around and checking for Rita. Redness, ecchymosis, edema, discharge, and approximation, cleaning around, and now I'm going to dry it out. Making sure that it's dry around the plastic side and everything. I throw that away with the fenestrated drape. Let me go ahead and lace it over here. Okay, great. So now I'm going to take this opportunity and do some suctioning of his mouth. And so I'm going to grab the yank hour. And as I'm suctioning his mouth, I'm checking his teeth and his oral mucosa, making sure that everything's okay. And so he looks pretty clear right now. I'm going to ask him, is there anything else that I can do for you? No? Okay. All right, so once I'm done clearing the table, I will document his discharge amount and how he tolerated the procedure and if he had any coca or readout right now.